Greetings, my name is Jude Domingo and today I will be performing the procedure for assessing the eyes and the vision. Let's get started. So the first step that we have to do is for us to introduce ourselves to the client and then verify the client's identity, why it's necessary, and how they can cooperate. We have to do this because we don't know if that's actually our client or the client is the same name, just so that we can avoid malpractice on a different client. And then we're also going to do this for trust, to build trust with the client, and then also to set their expectations on what's going to happen with the procedure. Now, the second step is for us to perform hand hygiene and other infection control procedures. Now, we have to do this because our hands are full of microbes, and the way we can at least eradicate some of these microbes is to wash your hands or to wear gloves. Either way, we're still going to wash our hands. Is a vital part of nursing. And then, of course, the third step is for us to provide client privacy. Now, this is important because it is part of our code of conduct that we have to provide confidentiality. Now, this is actually something that we have to do because some clients prefer that they are the only ones who's going to find out what's wrong with their current health status. And so that not many people will actually find out about the current health condition. It is a private matter, so keep it confidential. Now, the fourth step is for us to assess about the client's past health history in regards to family history with diabetes, blood dyscrasia, hypertension, eye disease, any eye injuries or eye surgeries, their last visit to a doctor or an eye doctor, which is either an ophthalmologist or an optometrist. We can also assess their client's use of medication, use of contact lenses, or use of eyeglasses, and their practices for keeping their corrective lenses clean, and also to know if there are any symptoms about the current eye disease. Now, the fifth step is for us to assess the eyebrows. Now, for us to assess the eyebrows, we have to do this because we're assessing for the hair distribution and the alignment of the eyebrow. And we're also going to assess the skin around the eyes for, of course, the quality and the movement. We have to do this because there are some underlying problems such as maybe sunken eyes or maybe uneven eyebrows. But not the ones that are drawn on, those are not included, but the naturally growing ones, those are included. If maybe some clients have uneven eyebrows, some clients have fading eyebrows like mine, they're not fit here. Now, this next step is for us to inspect the eyelash of the client, and to do so, we're just going to look at that or inspect it for the evenness of distribution of hair again, and then the curvature. Now, the normal for this one is evenly distributed, and then it's full, and then it's curving upward. It's curving upward, not downward, curving upward. Now, the seventh step for this is for us to inspect the eyelids for surface characteristics, and also for us to inspect the positioning in relation to the cornea, ability to blink, and then the frequency of blinking. And then we're also going to assess the lower lids when the eyes are closed. Now, when we're actually closing the eyes, as you can see, my eyes or my eyelids are normal. They have a little crease there. So far, there's no flaking or dandruff, or basically psoriasis on those areas are very fatal, or inhibits your field of vision. So those are the things that we have to do. And then the eighth step is for us to remove our gloves. Yes, remove our gloves and then discard them to the proper waste bin, which is the infectious waste bin, of course. And then, of course, the ninth step is for us to inspect the bulbar conjunctiva of the eyes for color, texture, and also presence of lesions. Now, like I said, lesions are an entryway for any microorganism to infect the body. So these are things we have to find out or to inspect. The 10th step is for us to inspect the cornea of the eye. Now, to do this, we're actually going to ask the client to look straight ahead, and then using a pen light here at an oblique angle, and then we're just going to slowly go over the corneal surface here. Like I said, I'm not doing it. Corneal surface here. And by the way, this is not a pen light, it's a stylus, just here, to observe that. Now, the 11th step is for us to inspect for the pupil size or symmetry of size, the color, and also the shape. In some cases, some agencies have sizing charts for their pupils. Now we have to assess this because the eyes, the pupils of the eye sometimes are misaligned, or sometimes the size is not the same. An eye is maybe smaller, the eyes may be bigger on the other side. And we have to assess those for symmetry. Now the 12th step is for us to assess the eye's reaction to light, and this is the direct and the consensual response of the eye. Now to do this, we're again going to get our pen light, and then we're going to shine, or at least, directly. We're going to partially darken the room first, and then we're going to stand in front of our client, and then we're just going to shine it first on this eye. And if it constricts, it means it's working well. Now we're also going to do it on the other side here. And if it's constrict, it means it's working well. Now that is the direct response. Now for the consensual response, we have to do this. We're gonna pen light here, or we're gonna shine it through here. And if this eye constrict, the ones that are not shading in, means that the consensual response is working perfectly. Now the 13th step is for us to assess the eye's reaction to accommodation. So continuing with the process, we're going to be taking the 14th step, which is of course to assess the client's visual peripheral field so that we can be able to determine the functions of the retina and the neuronal visual pathway, which is connected to the brain, and the second cranial nerve, which is the optic cranial nerve. Now to do this, we're going to be sitting, like what I said, sit in front of the client, directly in front of the client, at least 60 to 90 centimeters, or 3 to 2 feet, or 2 to 3 feet. And then we're going to ask them to cover their right eye. For us nurses, we're going to be asking to cover the left eye. And then we're going to be focusing on the client's nose while our eyes are focused. And they're also going to be doing the same, right eye, then focus on the nose. And then we're going to be asking them to focus on the object, or basically to determine where the object lands first. And first, since I'm the nurse, I'll be doing this. And then from here, we're going to say, where is the object now? And like the client says, we're going to say, it's in here, on this area, on my left side, or on the left side of the eye. This is the temporal field, and we're also going to be doing this for the upward field, or the up field, the down field, and also the nasal field. Now the 15th step is for us to assess the or basically we're going to do the 6 ocular motor movement to assess the alignment and the coordination of the eye. Now we're going to do this by not really maybe, but we're going to stay away from the client at least 1 feet, and then we're going to take again an object, and then fix the client on just one position, their heads, and then starting from the center, we're going to move from this side. And then we're going to stop periodically so that we will be able to determine nystagmus. So 1 part, again, 2 part, again, 3 part, and then good, again, and again. That's what we're going to do. Now the 16th step is for us to assess or do the Hitchberg's test, which is for us to assess the client's location for the light reflexes. We're also going to be asking our client to close their eyes, which is the 17th step, or ask the client to close their eyes, one part of the eye, and then have them focus on a near object and then a far object. And then to do this, we're also going to be doing this on both eyes. This is the cover eye test. Now the 18th step is for us to ask the client to get their corrective lenses for us to assess their nearsightedness or their near vision. We're going to ask them to get their corrective lenses if they need to, and we're going to have them read a magazine. Unfortunately, I don't have any magazine here at the moment, but we're going to have to let them read a magazine from at least 14 inches or 36 centimeters from us, and it should be in a language that they can understand. Now, for the 19th step, which is the far sight or far vision, we're actually going to be using the Snellen E-chart. And for this, we're going to allow the clients to use corrective lenses if the vision is not limited, or their vision is not limited to 36, or if it's not, or reading glasses. Now to do this, we're going to ask the client to be at least 20 feet away from the Snellen e-chart and then the client. And then we're going to ask them to determine what we're pointing at on the Snellen e-chart from the top up to the very bottom. And then what we're going to do is for us to have at least 3 versions of this test. One for this eye covered, or the right eye covered, and then the next one with the left eye covered, and the rest of the eye open, and then using them to view the Snellen e-chart. Now, the next thing, or the following thing that we have to do for this one is for us to record each and every test on their own separate charts. Now, the 19th step is for, or the 20th step is if the client ever does not see even from the very top of this Snellen e-chart, that means we're going to have a different type of, or a perform special visual test for them, or selective visual test for them. And of course, the 21st step is for us to document the findings in the client's record, either in a printed, electronic, or a checklist assessment based with narrative as appropriate. And again, thank you very much for listening.